When you have an invasive surgery, the recovery process can be intense. You may be questioning why your doctor assigned more treatment in the first place. Shouldn't the surgery fix everything? Whether you're having hip, knee, ankle, or even neck surgery, if the procedure affects a muscle or joint group, physical therapy can speed up the recovery process exponentially. By the end of this video, you'll know exactly why physical therapy after surgery can be beneficial, and more specifically, what you should expect.
Hi, my name is Caroline Pitts. I'm a doctor of physical therapy with 4.5 years of treating experience. I treat a variety of patients each day, with some of them rehabbing from orthopedic surgeries. Today, I'm going to talk to you about the benefits of physical therapy after surgery, the consequences of not getting therapy after surgery, and about how long treatment will last. There are multiple benefits to getting physical therapy after surgery. The first benefit would be improving mobility or flexibility. Mobility is just how much that joint is moving. So on your first session with your therapist, you'll assess, if it was a knee surgery, how much your knee will straighten and how much it'll bend. And then each session, we try to improve that mobility so that you can go back to your activity that you need to do, so that you can sit into a chair and let that knee bend. The second benefit is to improve strength. So you lose strength, obviously, when you have any type of surgery. It just happens, whether it's pain related or you can't use that muscle group. Each session we work on increasing that strength to get you back to your functional activities. The third benefit of getting physical therapy after surgery is to decrease pain and swelling. So after you have surgery, there's going to be some discomfort, and there's most likely going to be swelling in that area of surgery. So we work to move that area to decrease that irritation, to make it to where you can walk around your house or just returning to whatever activity it is. But we'll move that area in a safe way without hurting that surgery, but also to decrease your pain. The fourth benefit of getting physical therapy after surgery is to decrease scar tissue. So anytime that you're cut into with surgery, there's going to be some type of scar tissue buildup. So we work with hands-on manipulation, mobilizations, as well as just movement of that area to decrease that scar tissue. The fifth benefit of getting physical therapy after surgery, and probably the most important, is to restore your function and just get you back to your everyday tasks. So if you had a knee surgery, you're gonna have a little difficulty with walking right after, probably a little difficulty with balance. So those are things that we work on in physical therapy. And then obviously, by the end, we wanna get you back to whatever activity you were doing prior, whether it's an exercise activity, whether it's just getting around your house, or whether it's picking up grandkids. Whatever it is, we're trying to get you back to that activity without deficits, without pain, and strong and confident in that motion. If you don't get physical therapy after surgery, the joint or tissue of healing may not heal as properly as we would like it to, as if we strengthen and try to move that joint immediately after surgery. And we don't get those benefits that we just talked about. We don't get the range of motion sometimes or the strength as well as we would like to get you back to your functional task. But we also work as a team with our doctors. We keep communication with them so that the patient can get all the benefits that they would like from their surgery and from their therapy. The average time that it takes for physical therapy following surgery is about 8 to 12 weeks, but that depends on a couple of factors. One is motivation. 2 is the location or type of surgery. 3 is that person's personal pain threshold. 4 is the time that it takes for the soft tissue and bone to heal. An example is an ACL repair. So it's not a very invasive surgery, but there's a lot of healing that has to happen because You're repairing ligaments in there. You're also returning to a very intense sport usually. So the function depends on all of those factors, and going through physical therapy is going to be there to improve that strength so that you're less likely to re-tear that ligament, but also to get you back to that full sport activity without deficits. Also, your motivation to do your own home exercise program and be able to push yourself on your own is going to have a great impact on your function and your overall outcome following physical therapy and following surgery.
Thank you for watching. Choosing the right therapist is key to optimizing your outcomes after surgery. Check out our video on how to choose the right therapist by clicking the link in our description below. This video details the top qualities to look for when choosing your next physical therapist. If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.